see a benign lesion. Generally, a benign lesion is very easy to see, right? Easy to see, and there is a thick sclerotic line which separates zone of transition. So, if you want to know what is a narrow the bone to the disease, I think someone needs to mute them. Yeah, someone needs to mute them. So, a narrow zone of transition is when abruptly bone stops and disease starts. This is generally 1 millimeter or so. So if it's 1 to 2 millimeter, you call it a narrow zone of transition. Now that narrow zone can also have a sclerotic margin or can be without a sclerotic margin, right? So this is how a not so aggressive army will invade the home territory. They have invaded, but they are well contained with this wall. At the same time, we do not see. यार कोई इसको बोलो म्यूट कर ले ये था कौन है शायद मैं बोलती हूँ काफी गाड़ी वाड़ी चलती है or I think the host can also mute him.
म्यूट एवरीवन हो जाएगा. अनम्यूट सर ही नहीं हो रहा है.
सर म्यूट हो गया ना.
अभी अनम्यूट ही नहीं हो रहा.
ठीक है अब तुम वो सर को तुम वो कर दो अनम्यूट कर दो कर पाओ तो.
लेट एवरीवन अनम्यूट हो गया.
सर आपको अनम्यूट करना पड़ेगा.
ये सैयद म्यूट नहीं हो रहा है.
ठीक है तो हम यहाँ थे. So you can see the two armies do not have the wall in the middle, and then you can see there is sclerotic line on one side, but on other sides there is no sclerotic line. The demarcation is still pretty well defined. So this is also a benign, but a benign active disease. The earlier one was a benign inactive disease, right? The third is again a benign disease. You can still see the demarcation between the two armies, but the attacking army has kind of started attacking. The demarcation is blurred, right? So Avneet, you can beach mein you can just keep saying yes. Yes, sir. Yes, sir. Yes. Yeah. So this is a lytic lesion, but the zone of transition is not that narrow. Okay. So these are called geographic type of lesions. Geographic lesions are easy to see. They are generally benign disease, and their zone of transition is narrow. So when we say a geographic lesion with a well-defined sclerotic margin, this is a geographic lesion with a well-defined non-sclerotic margin, and more active or aggressive is a benign lesion or a geographic lesion with a ill-defined margin. Okay, these are the three kinds of benign diseases that you see. Why do we say?
Sorry to disturb you, sir. Sir, थोड़ा miss हो गया, sir. Can you please say this how to identify? We miss थोड़ा late join कर लिया, sir. Sorry.
So I started here. This is a benign disease where it's a narrow zone of transition. It's a well-defined margin. The two armies are standing against each other with a thick wall in the middle. The home army is relaxed. They don't have to worry. And you have the thick sclerotic line demarcating disease from bone, right? So this is a geographic lesion with a well-defined sclerotic margin. When the attacking army is standing but there is no wall, they are still kind of equally powerful, but they have become active. There is no wall. So now this is a geographic lesion again, well-defined margin again, because you can see the margin is well-defined, but without a sclerotic margin. So it's a well-defined margin with no sclerotic areas, right? This was well-defined margin with a sclerotic margin. So this is an inactive benign tumor. This is an active benign tumor, and the third will be an aggressive benign tumor. When you say aggressive, it's a ill-defined margin. Ill-defined margin can also be called a wider zone of transition. So a zone of transition, when you say you start walking from bone to the tumor, you can say probably it is starting here, someone will say no here, someone will say here. So it's a wider zone of transition. But still, it is a benign disease, and we'll discuss later on how. So you have benign inactive disease, well-defined sclerotic margin, benign active disease, well-defined non-sclerotic margin, and benign aggressive disease, which is ill-defined margin.
Ill-defined margin.
Correct. Now you have a situation where the attacking army is so powerful, they just destroyed cities and colonies and destroyed the local army. No, now you cannot say where was the host country or the host army. Everything is they have just walked over the home territory. So this is a kind of lesion where you cannot find the home army. They have probably run away to other parts of the country. Now here, if you start walking towards normal bone, you'll say, yes, I am sure this is normal bone. This is also normal bone. Then someone will say probably something has started here, or someone will say here, or maybe here. So where do you have a tumor that is definitely tumor? Here, here, but then there'll be areas which again are not so clear. So this is a very aggressive tumor, an ill-defined margin, and this is a permeative kind of a lesion, right? The earlier three were geographic lesions. This is a permeative lesion. Generally, in your exam, you will get a malignant tumor. So they will usually be a permeative kind of a destruction. So this is the destruction. Now, two standard views. How do you order an X-ray? You always say, sir, I'll order, suppose this is a distal femur tumor. You'll say, I'll order an X-ray of the knee of the right knee with thigh covering the whole bone. So if it's a distal femur, you'll say X-ray right knee with thigh including the hip joint. If it's an X-ray of the hip, then you'll say an X-ray of the right hip with thigh including the knee joint. So if someone asks you what is wrong with this X-ray, you will say, sir, one, it is only one view. I want two views, that is AP and lateral, and the other is it's not covering the whole bone. Ideally, the X-ray should cover the whole bone. The reason is that you might be having a skip lesion which you might miss, right? So two standard views, AP and lateral, whole bone needs to be covered, and then of course adequate coverage of adjacent areas including the soft tissue. So whole soft tissue should be seen. So this is how you order your X-ray. So how to make a diagnosis? You can say, I've seen that before, so I know that this is the X-ray of so and so. But with you, a better way is to solve it like a jigsaw puzzle. You put pieces together and then say what it is. What do you look at? You look at the appearance of the X-ray, how it looks, location, density or the matrix, and other things. We'll see how. So when you look at the X-ray, you have to look for pattern of bone destruction, whether it's geographic or moth-eaten or permeative. What are the three? Avneet, you can say. Geographic,
permeative, moth-eaten,
yes,
and geographic.
Yeah, so the least active or benign is geographic. Intermediate is moth-eaten. Moth-eaten typically myeloma mein hota hai. For you, you are going to get osteosarcoma, Ewing sarcoma or chondrosarcoma. For you, it will usually be a permeative type of bone destruction. So bone destruction is what the tumor is doing to the bone. So that is bone destruction. So permeative type of destruction is usually what you'll get. और क्या देखोगे? जब आपने डिस्ट्रक्शन का पैटर्न देख लिया, फिर आप एडजेसेंट बोनी कॉर्टेक्स देखोगे. ओके? और कॉर्टेक्स के बाहर क्या है? पेरियोस्टियम है.
Periosteum.
तो पेरियोस्टियल रिएक्शन देखोगे. पेरियोस्टियल रिएक्शन क्यों होती है? Whenever the periosteum is irritated because of anything, it could be a fracture, it could be a tumor, infection, then it starts forming bone. So जिस तरह से वो bone बना रहा है, वो दिखाता है कि ये malignant है या benign है. Okay? So pattern of bone destruction, then bony cortex, and then the periosteal reaction. Cortex में क्या देखोगे? Cortex destroyed है कि नहीं है. ठीक है? And then
Sir, how do we say it's a mineral cortex या फिर the different types of cortex?
yeah. So वो cortex नहीं है, वो matrix है जो आप कह रहे हो.
Yes.
Right?
Yes.
Cortex तो bone का cortex है जो host cortex है. Matrix is what the tumor is producing, the third here. तो matrix है जो tumor के substance में एक्सरे में दिखता है. आपको सिर्फ 3 टाइप के ट्यूमर मैट्रिक्स याद रखने हैं. Osteoid, chondroid and no matrix at all. एक चौथा मैट्रिक्स होता है फाइब्रस, जिसको ग्राउंड ग्लास बोलते हैं. वो आपको याद रखने की जरूरत नहीं है, आपको फाइब्रस डिस्प्लेजिया का एक्सरे नहीं मिलेगा. ठीक है ना? सो ऑस्टियोइड, कॉन्ड्रॉइड और प्योरली लाइटिक और नो मैट्रिक्स, 3 ही तरह के मैट्रिक्स होते हैं आपके लिए. राइट? देन लोकेशन ऑफ द लीजन विद इन द बोन, वेदर इट्स longitudinally, whether it's epiphyseal, metaphyseal or diphyseal, and transversely, whether it's central or eccentric. Right? अगर पूरी बोन को इन्वॉल्व कर रहा है तो सेंट्रल एक्सेंट्रिक का कोई वो नहीं रह जाता है. Then the site, for example, it is the upper humerus, lower humerus, distal femur. So all of this gives you a clue to what the diagnosis could be. अब हम फिर से आते हैं पैटर्न ऑफ बोन डिस्ट्रक्शन पे. हमने पढ़ा था मोस्ट बेनाइन इज ज्योग्राफिक, उसके बाद है मॉथ ईटन, उसके बाद है परमिएटिव. राइट? तो ज्योग्राफिक में क्या है कि डिस्ट्रक्टिव लीजन है विद शार्पली डिफाइंड बॉर्डर, आपको बड़ी आसानी से दिख जाता है. और ये 3 टाइप के होते हैं: वेल डिफाइंड स्क्लेरोटिक मार्जिन, वेल डिफाइंड नॉन स्क्लेरोटिक मार्जिन एंड इल डिफाइंड मार्जिन. ठीक है? इल डिफाइंड मार्जिन यूजुअली जायंट सेल ट्यूमर, एग्रेसिव एन्यूरिज्मल बोन सिस्ट, ऐसे एग्रेसिव ट्यूमर्स में मिलता है. Again repeat, a lytic lesion with a well-defined sclerotic margin is an inactive geographic kind of a lesion. It's an inactive benign tumor. Again, geographic with well-defined non-sclerotic margin is again benign but active. Again, geographic is well-defined. Here we can see non-sclerotic in areas, in some areas it is sclerotic also. Again, benign tumor. Okay. Then it is again geographic but ill-defined margin. You can see the margin is now become ill-defined. Okay, so that's another geographic
Sir,
type.
fracture in this also. There is a fracture.
There is fracture.
So अभी तो हम सिर्फ बोन, हम किसी भी एक लीजन, एक डिस्क्रिप्शन के ऊपर बेनाइन मैलिग्नेंट डिसाइड नहीं करेंगे. We know this is a geographic kind of a destruction, but still we can see fracture, we can see cortical expansion and destruction. So we know this is probably a malignant lesion. Right? So we'll put everything together, only then decide whether it's benign or malignant. Again, you can see a geographic lesion but ill-defined margin. ये iliac bone का पूरा destruction है. Again, geographic lesion with a ill-defined margin. ये infection है. Again, a geographic lesion with ill-defined margin. Now, if someone wants to call it permeative, you can argue, but we can see that even with the cortical destruction, जहां bone के साथ वो है, वो बहुत ज़्यादा permeative नहीं है. You can say it is probably finishing, the tumor stops here and bone starts here. Moth eaten क्या होते हैं? When there are, जैसे दीमक लकड़ी को खाती है. So that is moth eaten. This is typically seen in myeloma. You can see small wormholes. They are all, in place longitudinally along the bone. And this is a moth-eaten type. This is also typical of an aggressive lesion. But the one that, this is again moth-eaten in myeloma. But the one that you will get is a permeative lesion Again wormholes, but these wormholes जैसे individual छोटे छोटे थे यहाँ पे, they start coalescing with each other, they start merging with each other and become larger holes. So this is usually with a aggressive malignancy. Here you can see you're not sure whether tumor is finishing here or here. It's a very wide zone of transition. And again, if you repeat geographic, moth-eaten is more aggressive, permeative is the most aggressive lesion. Now you look at periosteal reaction. So आपने pattern of bone destruction देख लिया. इस बारे में किसी को कुछ पूछना है तो पूछ सकते हैं.
ठीक है सर, आई थिंक.
Okay. So next thing you look at is periosteal reaction. और उससे पहले आपने cortical destruction. So when you say आपने पहले pattern of bone destruction देखा, then you look at cortex. Cortex में कोई destruction है यहाँ पे?
Cortex is well preserved,
intact. So which means it's a very benign kind of a lesion. यहाँ पे cortex में destruction है.
there is no differentiation of cortex here.
So cortex is destroyed. So it is more aggressive, right? So इसी तरह आपको pattern of bone destruction के बाद cortex देखना है. Then you look at periosteal reaction. So if you follow a pattern, आपने bone के बीच में से शुरू किया और बाहर आ रहे हैं, या कुछ लोग बाहर से अंदर आते हैं, you can develop your own method of describing an X-ray, right? So now cortex के बाद आपको रहता है periosteal reaction. Periosteal reaction will happen in response to any periosteal injury. Now a tumor which is very aggressive will not give periosteum time to form bone, right? बहुत जल्दी जल्दी अटैक कर रहा है, periosteum को इतनी जल्दी elevate कर रहा है that before it gets time to form bone, it is destroyed further. So that is an aggressive kind of a periosteal reaction. Let us see. In a benign tumor, either there will be no periosteal reaction or it will be a solid periosteal reaction. Solid matlab over months periosteum it gets elevated just a bit, and during that time new bone forms between the periosteum and the cortex. That's a solid periosteal reaction. If it's more aggressive, it's lamellated, sunburst or Codman. Let us see what are these. So a benign tumor will have no periosteal reaction, or it will be a solid periosteal reaction. Solid में क्या हुआ? थोड़ा elevate हुआ, but periosteum के पास time था, it starts forming new bone. But in lamellated, what happens is periosteum gets elevated, and then see here, periosteum gets elevated, then before it gets time to form bone, it gets elevated further. It's again forming bone, but then gets elevated further. So this is what you call a lamellated or an onion peel periosteal reaction. This is typical for Ewing sarcoma, but it's not as if it cannot occur in other malignancies. This type of periosteal reaction is typically seen in malignancies. Now what is sunburst? If it's even more aggressive, periosteum gets elevated so fast that it only has time to form bone along the small vascular channels between the cortex and the periosteum. So the cortex did not have time to form bone like this, but it only has time to form bone along the small vascular channels which are there between the periosteum and the bone. This is a very aggressive kind of a periosteal reaction. This is called sunburst. What is Codman? It is even more aggressively lifted, but so what happens is it cannot form any bone from where it is lifted, but at the angles it still is not elevated that fast. So some bone will form at the angle. So this is called a Codman triangle. So Codman triangle, again, if suppose this was a complete line, then we would not call this Codman triangle. Codman's triangle is when it's only at the two ends of the elevated periosteum. So what does it say? It says that the rest of the periosteum had no time to form bone. It could form bone only at the edges. Again, this is typical of a very aggressive lesion. So when we look at periosteal reaction, when we say no periosteal reaction or solid periosteal reaction, it's benign. Then sunburst, onion peel and Codman are malignant. Anything you want to know about periosteal reactions? nothing.
ठीक है
Then we see जो अवनीत कह रही थी जो कॉर्टिकल स्क्लेरोटिक ऑस्टियोइड और ये सब. सो कॉर्टेक्स नहीं होता, वो ट्यूमर मैट्रिक्स होता है. So the tumor matrix, where is the tumor matrix? It's within the substance of the tumor. It is something that the tumor is forming. It's not the remnant of the bone. एक चीज होती है कि ट्यूमर ने डिस्ट्रॉयड किया तो रिमेनिंग बोन कैसी दिख रही है, वो अभी तक हमने देखा. बट नाउ व्हाट वी आर टॉकिंग अबाउट इज व्हाट द tumor is forming. So you only have to remember three types of tumor matrix: osteoid, chondroid, and no tumor matrix or purely lighting. Right? Now tumor matrix will depend on the histopathological type and not on the aggressiveness of the lesion. Am I clear?
yes sir
If the tumor is forming osteoid and the other features are benign, you call it an osteoblastoma. If the tumor is forming osteoid but the other features are malignant, you call it a osteosarcoma. Fine?
Yes.
Now, when you talk of osteoid matrix, typically you remember a cloud in the sky or a cotton wool. Anything that looks like cloud or cotton wool is osteoid. Fine? So you can see here the hazy kind of, now obviously it is overlapping the host bone, so some areas you cannot discern. But what do you think of this? Can you follow my cursor?
Yes, sir.
Is my cursor seen? Yeah. So this is kind of a cotton wool. You can imagine again, this obturator foramen is showing some cotton wool kind of a pattern. So this is an osteoid matrix, and we know, again you can see here. So we know that this is a osteoid forming tumor. We also know that the pattern of destruction is probably permeative. You can see here, it's a very wide zone of transition. आपको एक मैलिग्नेंसी का फीचर नहीं मिलेगा, दूसरा मिल जाएगा, और पहला वाला आप अपने आप बता दो. अगर आपको लग रहा है कि ये वाइड जोन ऑफ ट्रांजिशन है, तो आप अपने आप कह सकते हैं इट्स अ परमिएटिव काइंड ऑफ डिस्ट्रक्शन. You have to add up everything to.
इसमें ये तो सर it's Cordman ना सर the periostal reaction सर.
तो कॉर्डमैन यहाँ पे ना ये लॉन्ग बोन नहीं है, इसलिए उतना टिपिकल पेरियोस्टल रिएक्शन यहाँ मिलेगा नहीं. कॉर्डमैन कहाँ पे कह रहे हो? इधर?
जी सर
दोनों साइड्स पे जो एंगल बन रहा है.
तो मुझे लगता है कि ये पेरियोस्टल रिएक्शन ना होकर ये ट्यूमर मैट्रिक्स ही है. ऐसा टिपिकल कॉर्डमैन आई कैन नॉट अप्रिशिएट. But sometimes with X-rays, see, you could be seeing something that I can't. It has to be sum total of everything. And obviously कोई bizarre सी चीज बस ना बोल दो. अगर नहीं लग रहा तो थोड़ा कम ही बोलो, ठीक है ना? So osteoid के बाद हम chondroid पे आते हैं. Chondroid is when you look at a popcorn or small dots. So it will again be mineralized, but it will be small dots or small popcorns. In between one popcorn and the next, there will be nothing. Whereas in osteoid, it's a continuous kind of a hyperlucent area or radiopaque area. Right? So यहाँ पे आपको देख के पता चल रहा होगा एक कॉटन रखी हुई. जबकि आप कॉन्ड्रॉइड देखेंगे तो आपको क्या दिख रहा है? ये पॉपकॉर्न है, बीच में खाली जगह है. So obviously CT में बहुत अच्छा दिखता है, but इसी का हम एक्सरे देखें. So you can see these look like popcorns, but the areas in the middle have absolutely nothing. There are like intermittent lighting areas. But again, if someone argues that this could be osteoid, you can always argue, and if there is any doubt, you can do a CT, and CT will show that no, it's actually a popcorn. So this is how a popcorn kind of a mineralization happens in cartilaginous or chondroid matrix. Okay, then this you can ignore. And then comes the location of the lesion within the bone. You have to remember epiphyseal tumors are GCT, chondroblastoma, and clear cell chondrosarcoma. For you, diphyseal tumor is Ewing sarcoma, and all others are in the metaphysis. So, Syed, you can repeat. Epiphyseal tumors are. Avneet, you can repeat.
Sir, the chondroblastoma, giant cell tumor, and chondrosarcoma are epiphyseal tumors.
Only clear cell
Giant.
sarcoma. Only clear cell variety.
Okay, sir.
Okay, sir.
राइट तो आपके लिए अगर जो आता है वो ज्यादा से ज्यादा जाइंट सेल ट्यूमर का डिफरेंशियल में आ जाएगा तो जीसीटी इज एपिफाइजियल ऑलवेज राइट इन अ स्केलेटली मैच्योर स्केलेटन Ewing sarcoma
Even a classic chondrosarcoma is metaphyseal always.
Yes, a classic chondrosarcoma is metaphyseal. So which is why I have written metaphysis all others. So most malignancies that you'll get will start in the metaphysis. They may go on to involve epiphysis or adjacent diaphysis. And there is no rigid rule. It's not as if osteosarcoma cannot happen in diaphysis. Similarly, Ewing sarcoma quite often is metaphyseal. But classically, epiphysis is GCT, diaphysis is Ewing sarcoma, and osteo and chondrosarcoma are metaphyseal. तो दिस ये तो पिक्चर है आप मेरे ख्याल से इतना जानने की और कंफ्यूज होने की जरूरत नहीं है सिमिलरली सेंट्रल एंड एक्सेंट्रिक आई थिंक मोस्ट ऑफ दीज अप्लाई टू basically guess whether it could be a particular lesion. For example, osteoid osteomas are cortical based, so I think इसको भी आप ignore कर सकते हो. But in your description of the X-ray, if you are able to say it's an eccentric lesion, then that leaves a good impression. So then characteristic locations, simple bone cyst आपके मतलब का नहीं है, but you should know certain locations. For example, adamantinoma is typically seen in the tibia. Chordomas are typically seen in sacrum and
Vertebra.
cranial cervical junction, the two ends of spine. So that is chordoma. And adamantinoma typically seen in tibia and mandible. These are two locations, right? Now epiphysis, this we have seen. Adamantinoma is in tibia, chordoma is in sacrum and clivus, osteoblastoma you can forget. And the last thing after you have described your pattern of bone destruction, then you come out cortical destruction or not, then you come out periosteal reaction, then tumor matrix, and then soft tissue extension. If there is soft tissue extension, it's usually malignant or at least very aggressive. Fine. So if there is no soft tissue component, you can say it's a benign lesion. So now let us see benign versus malignant lesion. A malignant lesion will have, let us start with the pattern of bone destruction. It will be a permeative destruction with a wide zone of transition. It will be a periosteal reaction which will be interrupted variety and not a solid periosteal reaction. Interrupted varieties are onion peel or codman or sunburst. Right? If you cannot see a periosteal reaction, just say I cannot see a periosteal reaction. Sometimes tumor will be so aggressive, जैसे कि कोई bomb blast हो गया हो and there is nothing to see there. So there you see no periosteal reaction, which is even worse, right? So it's not as if आपको जो नहीं दिख रहा है वो भी बोलना है. After you have described the periosteal reaction, you talk about the soft tissue mass. If there is soft tissue mass, it is malignant. On the other hand, a benign lesion will be having well-defined margin with narrow zone of transition, a geographic type of destruction, no cortical destruction, no soft tissue mass, and a periosteal reaction that is solid or absolutely no periosteal reaction. Fine? Any clarifications on this?
No.
So now we will start a small test between Syed and Avneet. You can start talking about this X-ray. These are two X-rays, very similar looking. Fine? So I'll start asking the age. It is skeletally mature or immature?
Sir, it's mature. The first X-ray, both the X-rays show a mature skeletic because the physeal has fused.
Yes. Then location?
Sir,
Sir, it's a metaphyseal lesion with it's a metaphyseal permeative eccentrical lesion with the
अभी रुक
yes
जाओ एक्सेंट्रिक क्यों है ये तो बीचों बीच है बोन के एक्सेंट्रिक कब होगा जब एक साइड में होगा है ना
ठीक है सर
just answer what I am writing here. The site is metaphyseal versus this one is
Diphyseal.
नहीं डायफाइजियल
Diphyseal.
हाँ यहाँ से लेके यहाँ तक ट्यूमर है देखो and the epiphysis is free of any tumor.
yes
ये तो पटेला है otherwise tumor starts here in the metaphysis and you can call it a metadiphyseal tumor also. Okay, periosteal reaction इसमें है
I cannot appreciate a periosteal reaction
इसमें
इसमें है सर it's a laminated kind of
correct laminated. You could have called it solid if this break was not there.
yes
So it's not a solid periosteal reaction. Now you are beginning to think how aggressive these two lesions are. So on the right side, as you said, it's lamellar. On the left side, there is no periosteal reaction. Now cortical breach. Is there cortical breach or thickening?
no sir there is no cortical breach
Here, is there any cortical breach or thickening?
sir there is cortical breach sir yes
Here is the cortical.
yes sir
You can see the white line on the inside is the cortex and there is a breach here. Okay, so periosteal reaction and cortical destruction are matching with each other in this case. What is the matrix?
osteoid matrix in the second one sir
Okay, how about this and this?
osteoid sir
So ठीक है, but I think if someone calls it popcorn also, that will be right. See, again, as I said, when you have osteoid, it will be a continuous kind of a thing. Now, इधर आप देखेंगे तो दो अलग अलग लीजन पड़े हुए हैं और ये भी पॉपकॉर्न की तरह दिख रहा है, देन बीच में खाली है ना? बट ठीक है, आई थिंक अगर आप इसको ऑस्टियोइड भी बोलते हो तो कोई बहुत गलत नहीं हो जाएगा. एटलीस्ट यू नो दैट देयर इज अ mineralized matrix. It is actually chondroid on both sides. Size, this is large, this is small. ठीक है ना?
yes
This is small, this is large because starting here and going into the diaphysis, we don't know how much more. So diagnosis will be, it is a benign chondroid lesion, that is an enchondroma. This is a malignant chondroid lesion, that is a chondrosarcoma. But at least by a mathematical deduction, you could say that the one on the right is malignant and the one on the left is benign. इतना तो बोल पाए आप, है ना?
हाँ जी.
And then of course अगर मैट्रिक्स बोल दिया तो ये हो गया कि chondrosarcoma है और ये enchondroma है. अब सैयद आप बताओगे ये साइट क्या है within the bone, whether it's metaphyseal, epiphyseal or diaphyseal. सैयद गायब हो गया. अवनीत आप बताओ.
डायफाइसियल है सर. सॉरी सर मेरा ये
हाँ ठीक है. फाइन. सो इट्स अ डायफाइसियल ट्यूमर. अग्रीड. नाउ पेरियोस्टल रिएक्शन है कि नहीं है?
सर आई कांट अप्रिशिएट अ पेरियोस्टल रिएक्शन.
है.
सनबर्स्ट जैसा लग रहा है.
यहाँ पे एक दो जगह सनबर्स्ट है, अदरवाइज बाकी हाँ.
So it's a very significant. See, this one may be very faint, but this definitely is there. This is
yes,
there, and there is also a faint of Codman, if you can appreciate. Okay, but Codman को miss कर भी सकते हो. Sunburst तो है ही. It's a sunburst kind of a periosteal reaction और speculated भी बोलते हैं इसको. Cortical breach और thickening है कि नहीं है?
There is a definite cortical
breach or cortical destruction, whatever you want to call it.
Sir, there is a zone of transition in this, right?
हाँ, so zone of transition कैसा है? कहाँ से normal bone शुरू हो रही है? यहाँ कुछ दिख रहा है?
Yes sir.
But obviously अवनीत देखोगे ना कि आप जब speculated या periosteal reaction sunburst है, तो zone of transition कैसा expect करते हो?
Permeative.
हाँ, permeative zone of transition wide होता है. Zone of transition is wide or narrow, destruction is permeative, है ना? So जैसे ही आपने देखा कि periostal reaction sunburst है, you can call it a permeative lesion with a wide zone of transition. Matrix, there is no matrix.
No matrix.
There is periostal reaction, but as such tumor is forming no matrix. Zone of transition is wide. This medullary canal can be appreciated, cannot be very well appreciated here. यहाँ पे अच्छे से हो रही है, probably यहाँ से obscure होना शुरू हो गई है ना? So it's a wide zone of transition, and diagnosis is most likely a malignant tumor in the diaphysis with no matrix formation, most likely
Ewing sarcoma.
अब अवनीत ये बताओ आप, एज skeletally
sir cannot comment on the no sir, size is closed, sir.
Closed है, so skeletally mature. Site is
Metaphyseal.
Metaphyseal.
It's a well-defined
Okay.
geographical lesion with narrow zone of transition, sir.
So क्या होता है ना, geographic क्या है? Pattern of bone destruction है, ठीक है? जब ट्यूमर मैट्रिक्स इतना डेंस है तो आपको डिस्ट्रक्शन एक्चुअली दिखेगा नहीं कैसा है. What you are seeing is a tumor matrix, isn't it?
Yes.
So you can omit the destruction part. You don't know how, because the dense matrix is overlying and obscuring everything else, right? Matrix कैसा है ये?
Osteoid matrix.
बिल्कुल osteoid है, इसमें कोई डाउट नहीं है. This is a typical osteoid matrix, and the diagnosis is a osteosarcoma.
Yes.
Right? क्योंकि osteoid forming benign tumor तो ये हो नहीं सकता, because there is
a significant soft tissue extension.
Yeah, so that clinches for you. You may not see a periostal reaction, you may not see destruction because the matrix is so dense, but you can definitely see a large extraosseous soft tissue, right? So it's a osteosarcoma. अब इसको देखते हैं. ये बताना.
There's a geographic lesion.
Yeah.
There is a geographic lesion with ill-defined margins. It is likely a benign tumor. Likely, तो सर इसमें there is destruction of matrix. It is typical of giant cell tumor.
So there is no matrix, and there is some ill-defined zone of transition or wide, a slightly ill-defined margin, but still it's purely lytic and epiphyseal and eccentric. It's a giant cell tumor. Again, you can say benign because there is cortical thinning, but
cortical preservation of cortex, and there is no extraosseal extension.
No extraosseous soft tissue component. So it's a giant cell tumor. इसको छोड़ देते हैं. वैसे यहाँ पे ये chondroid है. There is chondroid matrix and there is
destruction of cortex. Yes, sir.
There is also a fracture. So all of this will happen in a benign tumor. So it's a chondrosarcoma of the proximal femur. Again, Avneet, you want to try this?
It's a skeletally immature, sir.
Okay, or maybe adolescent, just about to mature. I agree. Skeletally immature, fine.
X-ray of the right knee. Although I cannot appreciate the joint above this.
Yeah.
On the right knee, there is a permeative lesion with well-defined zone of transition.
तो ये दोनों चीजें साथ में.
Zone of transition नहीं होगा well defined अगर permeative lesion नहीं है फिर.
हाँ. So if the lesion is permeative, then automatically
there is
so now you can say that, see, on the lateral view, यहाँ तक ट्यूमर दिख रहा है ये?
Yes, sir.
Yes, sir.
कोई कहेगा यहाँ तक दिख रहा है,
Yes, sir.
कोई कहेगा
Yes, sir.
यहाँ तक दिख रहा है. So it's आप you have to be intelligent enough to put two and two together. If you are saying it's a permeative lesion, then it means that there is a wide zone of transition.
Yes, sir.
ठीक है?
Yes, sir.
Okay. So it's a permeative lesion, a wide zone of transition, and
With
With
bony
bony
destruction
destruction
okay,
and soft tissue with sunburst kind of periosteal reaction and soft tissue mass,
okay.
probably an
probably an
Sunburst कहाँ है
osteosis.
बताओ? Sunburst कहाँ है?
Sir,
सर
cortical
ये
destruction
कॉर्टिकल
के
डिस्ट्रक्शन
बाद
के बाद ऐसे वो
ये
हाँ जी सर,
हाँ जी सर,
ये soft
अच्छा.
tissue
ये सॉफ्ट टिश्यू कंपोनेंट है.
हाँ, ये actually matrix है.
Mm.
It is an osteoid kind
It
of
is
matrix.
immature matrix,
Yeah, so it is tumor
less
matrix.
calcified.
You can, even though here, but here you can see it's a very continuous kind of an osteoid matrix.
सर
And
लेफ्ट साइड इमेज में 11 o'clock पोजीशन में हल्का सा पेरियोस्टम एलिवेटेड है ना सर, नियर द टॉप एंड लेफ्ट
yeah,
साइड में. हाँ यस यस.
this is a Codman's triangle.
हाँ
Yes, sir.
यहाँ भी posteriorly there is a very beautiful Codman's triangle. So a Codman's triangle, यहाँ पे आपको the only periosteal reaction that you can see is the Codman's triangle, which again is indicative of a malignancy.
सर
Now,
इसमें जैसे सर देयर इज जो कॉर्टेक्स है इट इज लेस ऑसिफाइड एंड मतलब इसको कैसे डिफरेंशिएट करेंगे?
so there is
पॉपकॉर्न एंड क्लाउड.
see, you can say there is cortical destruction here.
स्कैलोपिंग बोल सकते सर उसको.
हाँ, स्कैलोपिंग भी बोल सकते हैं, बिल्कुल बोल सकते हैं.
यस सर.
बट सी इसको आप कह सकते हो पॉपकॉर्न है, बट यहाँ जो दिख रहा है ये बड़ा सा,
जी सर.
ये ऑस्टियोइड है,
ठीक है सर.
सो क्लासिकली. एंड देन अगेन यू हैव टू सी 16 साल के बच्चे में क्या होगा, ऑस्टियोइड होगा कि कॉन्ड्रोइड होगा, कॉन्ड्रोसार्कोमा होगा कि ऑस्टियोसार्कोमा होगा. तो जब आप ये चीजें दिमाग में रखते हो ना, आपको अपने आप ऑस्टियोइड शुरू हो जाएगा, बिकॉज़ देन यू आर लुकिंग फॉर ऑस्टियोइड, राइट?
ठीक है सर.
सो दिस इज एन ऑस्टियोसार्कोमा. So now I give you an X-ray, कोई भी X-ray लेते हैं, and then you have to know how to describe that X-ray, right? तो वो करके अब ये X-ray है. How do you describe an X-ray? ये तो एक ही व्यू है. So when you describe an X-ray, sir, this is an AP. This is an X-ray of the right knee of a skeletally mature person, showing AP and lateral views. The lower half of the femur and the upper, probably 1/4 of the tibia, is seen. The X-ray shows a large tumor involving the distal metaphysis of the femur
with diaphyseal extension.
With diaphyseal extension, you can say that. With a tumor that is showing an osteoid matrix with a large soft tissue component, mainly on the medial and the posterior aspect, also involving the femur eccentrically. You can say eccentric because there is no anterior part, so posteriorly it is eccentric, right? The tumor shows whatever zone of transition, whatever pattern of destruction, with the soft tissue component and whatever periosteal reaction. So इस तरह आपका डिस्क्रिप्शन होना चाहिए. सपोज मुझे ये वाला lesion describe करना है. This is an X-ray of the femur showing the lower half of the femur, AP view in a skeletally mature person. The X-ray shows a tumor involving the distal metaphyseal and adjacent diaphyseal areas. Now I'll start from the middle. I'll सबसे पहले बोलूँगा pattern of bone destruction with a permeative kind of bone destruction with cortical breach and a lamellated reaction. The tumor matrix is chondroid and there is no soft tissue component. बस ये 5 चीजें आपको बोलनी है और अपना डायग्नोसिस बताना है.
ठीक है.
Any more questions? In a skeletally immature person, and as you said, permeative destruction से शुरू किया आपने, फिर cortical destruction से शुरू किया, lamellated periosteally action, no soft tissue component and no matrix.
Yes, sir.
Tibia है तो we know that it's adenoadenoma, but this is how you will describe this.
Describe the reason. Yes.
ठीक है जी.
ठीक है जी. Thank you, sir. Thank you so much.
Thank you.